Local and systemic hemostatic agents. Methods of achieving hemostasis. We have mechanical methods in that first is pressure. Firm pressure should be applied over the bleeding site using either fingers or gauze for at least 5 minutes. This is control most hemorrhages by counteracting the hydrostatic pressure of the bleeding vessel. Next, second is hemostat. It helps in direct occlusion of the bleeding vessel. Third is suture and ligation. Suturing replaces the hemostat as a permanent method of effective hemostasis. Chemical methods. First is adrenaline. Topical application of adrenaline brings about vasoconstriction. The concentration of 1 in 10,000 is used for hemostasis over the oozing site. Thrombin helps in converting fibrinogen into fibrous clot and act as a hemostat. Surgical is an oxidized cellulose polymer obtained by dissolving pure alpha cellulose in an alkaline solution. It acts by forming acid products from partial dissolution that coagulates a plasma protein to form a black or brown sticky gelatinous clot. It resolves from the site in 4 to 8 weeks. Surgical fibrillar, it's a modified surgical or oxidized regenerated cellulose in layers that can be adapted to irregular surfaces and inaccessible areas. Complete resorption occurs in 2 weeks. Oxygen. Oxygen is an oxidized cellulose polymer. The cellulosic acid present in oxygen has affinity for hemoglobin, which leads to formation of artificial clot. It should be applied on the dry surface as acid formed during the wetting process inactivates the thrombin. The platelet plug into its meshwork-like surface and helps in clot formation. Gelatin sponge or gel foam or surgifoam. Gel foam is manufactured from purified pork skin gelatin. This is a non-antigenic and completely absorbable material. It has the capacity to absorb 45 times its weight in blood. It absorbs, it resorbs completely in 4 to 6 weeks. Microfibrillar collagen, it's derived from bovine skin, causes contact activation in addition to direct platelet aggregation. It resorbs time in 3 months. Fibrin glue, it's a biological adhesive which contains thrombin, fibrinogen, factor 7 and protein. Natural collagen sponge. This is a white sponge material, non-antigenic and fully absorbable. It stimulates the platelet aggregation, thereby enhancing hemostasis. It activates coagulation factor 11 and 13. Fibrin sponge. The fibrin sponge is non-antigenic and it's obtained from bovine. It stimulates coagulation therapy, forming the normal clot. It also acts as a temporary plug over a small injured blood vessel. The fibrin sponge is fully absorbed by the tissue within 4 to 6 weeks. Septics and estrogens precipitates protein and arrests bleeding. Monsil solution containing ferric subsulfate and tannic acid. Alginic acid, this is available in powder form in 5 mg packages. It is placed over the bleeding site. A protective film is formed over the bleeding site. This film compresses the capillaries and stabilizes the blood clot in place. Bone wax, it's a non-absorbable mix of waxes. It consists of 7 parts by weight of wax, which can be white bee wax, paraffin wax, and an isopropyl ether or ester of palmitic acid. 2 parts of olive oil and 1 part of phenol. It causes mechanical obstruction of the osseous cavity containing the bleeding vessels. Austine, it's a bone hemostatic agent made of water-soluble alkyline oxycopolymer. Austine has shown no adverse tissue responses or the interference with wound healing as seen with the use of bone wax. Like agent ethyl its activation of thromboplastic formation on damaged vessels and facilitates platelet aggregation. Dose is 250 to 500 mg oral or IV. Tranexamic acid, it's a synthetic derivative of the amino acid lysine and binds the lysine binding site on plasminogen. This inhibits plasmin formation and displaces plasminogen from the fibrin surface. It may also inhibit fibrogenolysis at higher concentration. Tranexamic acid is usually given as a bolus dose of 10 to 15 mg per kg IV. Haemostatic mesylate, it's a synthetic protease inhibitor and inhibits thrombin, factor 10A and 12A, kallikrein, plasmin, and complement factors. It also works as an antifibrinolytic, anticoagulant, and anti-inflammatory agent. Epsilon aminocaproic acid. It's a competitive inhibitor of plasminogen activation. Recommended dose is 150 mg per kg as an IV bolus before surgery, followed by infusion of 15 mg per kg per hour during the operation. Desmopressin acetate, pharmacologically altered form of vasopressin, causes the endothelial release of factor 8 and 1 bilirubin factor into the plasma. The release factor form a complex with platelet and enhance their ability to aggregate. Dose of 0.3 mg per kg in hemophilia A, 1 Willebrand disease and in perioperative setting. Thank you.